Okay, so me and Jack both had very interesting interviews. To start off, so my first interview was with my dad, who I guess some demographics, he's a white male in his 50s. So he talked about how, he's a diabetic. So his first doctor that he went to see to kind of give advice and like treatment options for his diabetes was very like black and white. Definitely kind of saw things as like I know the right way and I know the wrong way. Just seeing that like one right, one wrong.
Yeah, I definitely feel like the doctor should have been more along the lines of suggesting things. Like I'm the doctor and this is my advice, instead of you need to do this, that kind of
Right.
advice.
Yeah, he was a little more demanding. Like I'm the doctor. I kind of know what's best. Especially my dad brought up the doctor immediately said like, okay, so no more eating bread and stuff like that. So just telling me he couldn't eat certain foods, which is kind of harsh.
Yeah, it still is her dad's life, and his diet is his decision. Obviously, the doctor has every right to make recommendations to improve his health, but as she said, he was making demands instead of suggestions, which we don't think is the best way.
Right. And so my dad actually ended up switching doctors, and the doctor he switched to now is definitely more understanding. And his take on giving medical advice is more of like the shared knowledge, kind of relating to the shared mind that we talked about in some of our articles and in class. So basically saying like, okay, well, if you eat too much bread or if you do this or that, like this will happen. But left the choice up to the patient. So left the choice up to my dad. Like, okay, it's not the best if you have so many carbohydrates, but if you're gonna do that, well, this is what's gonna happen. But it's ultimately up to you. So more like, you should try to avoid this, but not like, oh, you have to avoid this. And emphasize like practicing moderation, eating in moderation, and stuff like that. And the big point that came across with that interview is just collaborative decision making. So obviously, I think that first doctor was not collaborating with my dad as much, taking into account the lifestyle he wanted to live, and his choice and not wanting to be so black and white and harsh about following rules to a T.
Absolutely, it's always a joint. It should always be a joint decision between the patient and the doctor, instead of just the doctor making all the personal decisions.
And then, so for my second interview, I interviewed my sister, who's a white female, and she's 18 years old. And this was from her experience with a pediatrician. So it was also my pediatrician, but hearing my sister's perspective was interesting. So our pediatrician, she never really showed emotion in a sense. Like she would rarely smile, and also not having that sort of like emotional or showing of emotion. She didn't really show empathy either. She would always literally come in the room with her laptop of things to say and things to do. And it seemed also that she was like trained in patient centered communication, because she would ask us, like, oh, how are your activities going? How is track and field going? Because my sister was on the track and field team and stuff like that. And then my sister would answer enthusiastically, like, oh, that's great. You want to know about my life. But she would never respond or try to engage in the conversation or even seem interested. So it wasn't really comforting, I guess, in that sense, just not being personable. And then it, I think, made the doctor patient relationship interesting, because if my sister's willing to share information with the doctor, but then the doctor's not like reciprocating that, it made her want to hold back a little bit, like, oh, I guess she doesn't really care about me, she's not that interested. And what really stood out to me with that interview was patient-centered communication, because it seemed like, and like we hear doctors have training, but maybe they're not executing this training effectively, because obviously she was trying to have patient-centered communication, with my sister asking about her sports and school and stuff like that. But not being able to reciprocate that and actually make a conversation and have her be comfortable, I guess, in a sense. It just wasn't executed.
Yeah, as it talked about in the readings, making the patient comfortable is super important to achieving the best possible outcome. And in the scenario she just presented, that obviously probably didn't happen by her not being personable enough and just kind of seemed like more so just going through the motions instead of, okay, let's make this patient comfortable and achieve the best possible outcome.
Right. And then one quote that really stood out to me was from page 402 from the article Patient-Centered Communication During Collaborative Decision Making. And it says quality medical decisions are not only based on the best clinical evidence, they are consistent to the degree possible with the patient's values and preferences. So in this case, we kind of saw, like with my dad, his value of having his own personal lifestyle and not adhering like so strictly to the rule book, I guess, and what to follow. And then with my sister's preferences and just having a more genuine and friendly relationship with the doctor.
So my first interview was with a friend of mine. He's of a racial minority. He's African American. And he experienced an unfortunate event in an emergency room. What happened was, after accidentally cutting very deep into her left index finger while attempting to cut steak with a sharp knife, she had to immediately be taken to the emergency room by her mom. After arriving at the emergency room, her finger was wrapped immediately to keep blood from coming out, but she was told that she would have to wait a little bit due to other patients being in more critical condition, being treated by all of their doctors and nurses. About 15 to 20 minutes later, a white older woman that appeared to her to have a similar injury and severity of wound on her foot came into the emergency room. She was taken into a doctor's room after only a few minutes, while my friend of African American descent had to keep waiting. My friend's mom was completely outraged but tried to keep calm when voicing her concern to the receptionist. The receptionist informed her that she was taken in before her daughter because her injury was more severe. However, my friend is an honest person, and from her view, it really seemed to her that the white woman's foot injury was of just about equal severity to her finger injury. My friend was taken in to get treatment a few minutes later, but had to suffer and bleed much longer than she probably should have. A quote that she said was, "I really felt like my race kept me from getting immediate treatment." And this friend of mine is 22. From my brainstorming, I really feel like quality patient-centered communication would have helped the situation here. Obviously, always, and regardless of the situation, race should not matter at all. Not at all.
Right. I think the focus, again, with patient-centered communication is focusing, it's not like patient's race or patient's culture or anything. It's the patient as a person. And I think that was something that was very overlooked there, because they seem to just see on the outside the race and culture instead of just, oh, this is a patient that needs our attention.
Yes. So from everything that she said in the interview, it really seems allegedly that racism very likely happened, which is obviously always unacceptable, and it just goes back to, like she said, the patient-centered communication. My second interview was with a friend who's 20 years old. He was going through a phase of sleeping with many women, but soon found a girlfriend and settled down. However, towards the beginning of the relationship, he started experiencing some serious itching and discomfort in his crotch area, and it was starting to really concern him. He went to his local health clinic, but unfortunately he didn't have health insurance at the time, and met with a doctor. After telling the doctor the symptoms he has been experiencing, he was asked how many women he has slept with. After informing his doctor of the number and that he rarely ever uses condoms, he received serious criticism for being careless about his health. While this is partly understandable, a number of women that my friend had been with was not really super outrageous given his age and stage of life, college student.
Yeah, I definitely think that's kind of insane too, because when you're speaking to a doctor, you're talking, it's a very like sensitive subject area about your health. And I think being with a doctor, you want that to be a safe space. So to feel like you're being judged for saying something personal like that should definitely not happen.
Absolutely. And he understandably felt that the doctor could have been way more professional, kind, and empathetic. And that meant, as she said, not judging the patient really under any circumstance. My friend was written a prescription for chlamydia medication. However, just to top all this off, 1 week later, the test results showed everything came back absolutely negative. He was completely fine. So that doctor was probably maybe exaggerating a little bit the problem and probably borderline harassing my friend.
Right. I think that's, again, going back to the patient-centered communication, I think, is what stood out to us with all of our interviews. Just that the doctor almost just came in, I feel like, with his doctor hat on, and they only know how to be a doctor, but in a sense they need to know how to be a friendly and someone that the patient can confide in, and just understanding the patient's point of view also, and not being so quick to judge, and actually fostering that relationship and communication aspect with the patient will help you understand their values and kind of the actual storyline and their needs and wants, which would in turn help you as a doctor, I guess, provide better care.
Absolutely. And the kind of the role communication played in creating both of these challenging situations is discussed in Everyday Interpersonal Communication and Health by Rebecca J. Welch-Klein. On page 377, Klein states that communication increasingly is recognized as a significant factor in healthcare and promotion. Health communication has become a vital part of national public health experts. I thought, after reading this quote, I thought that it supported how important quality and effective communication is between the patient and healthcare providers. If the patient feels that there is not quality communication between them and their healthcare providers, then they are way less likely to achieve the best possible outcome in their treatment. And as she said, it also goes into just treating the patient with respect and professionalism and making them feel comfortable.